Dentistry has changed a lot in the last 25 years. We now have technology that can greatly increase the rate of healing. One of the ways that we can increase the rate of healing is with something called PRF and PRP. What that is where we would draw the patient's blood and we would spin it down to get a concentrated clot of your own growth and healing factors. We use this to place into bone grafts around implants or to cover up the tissues while they're healing, and it greatly increases the rate at which the gum tissue heals. Another example of technology helping to increase the rate of healing is with laser technology, and there's various ways that this can help. One is actually using lasers to perform the surgery, but another way is what's called photobiomodulation or low-level laser therapy, where we take a specific wavelength of laser energy that targets the cells to draw all the healing cells to the site and heal the bone faster and with more density than it would on its own. So dental imagery has changed drastically in the last 25 years. Traditionally, we would use two-dimensional x-rays of the jawbone to plan implant placements. Now with CT scanning or three-dimensional imagery, we're getting much more precise planning. We can also use that 3D printing technology to print guides that will make sure that our surgery is actually executed in the manner in which it was planned. We have long-lasting anesthetics that were actually developed in hospitals for hip surgeries that we've started incorporating into our oral surgeries to keep patients comfortable for sometimes 5 to 7 days. With long-lasting anesthetics and IV sedation, we can keep patients much more comfortable, and it also will help to pharmacologically help with the inflammatory process that occurs after a surgery. To see for yourself what an advanced dental office looks like and how it can benefit your dental care for years to come, please call our office and schedule a consultation today.